All right, we've been talking about a lot of issues surrounding hormonal and pelvic health for women, specifically infertility, and how PCOS and endometriosis can both play a role in that. They have a genetic, a hormonal, and structural component. And so as we talk about some of the things that you can do to help your body and things that so many women suffer with but may not know solutions for, we want to talk about it because a lot of the treatment for those three things all circles around removing adhesions, addressing inflammation, and restoring a lot better circulation in the body. So please look back at those other videos for your specific concerns. This also would apply to fibroids that many women suffer with, or even just really excessive heavy clots or periods that are painful and really outside the normal shedding and detox that our body should do every month. Number one, great research article, we'll reference it. Studied women over a 10-year span, so that's really significant. And it was like, I think the subject group was like 1,300 women. So really substantial research done on manual therapy for the pelvic floor. And a lot of improvement in both fertility, reduced pain, reduced inflammation, overall symptoms. So I don't want to spout off a bunch of statistics to you. We'll link that. But bottom line, the manual physical therapy that we do for the pelvic floor, internally and externally, can really help to decrease inflammation. One important factor is our immune system is designed to deal with some abnormal cells or cells as they naturally die off and regenerate. But if there's structural adhesions and inflammation, that restricts blood flow, that restricts oxygen in the tissues, and then it impairs our body's ability to heal and deal with all of that. And it can just pile up and snowball into some of those cysts and fibroids and the endometriosis. So the pelvic floor therapy really gets in there to provide manual release to those tissues. The myofascial work we do is so perfectly suited for that because it's slow and gentle, and we're really waiting for those changes in that connective tissue and for the fluidity of those tissues to be restored. One of the most exciting things I want to share with you is some new technology. It's actually not new technology. The uses within pelvic health are really recent over the past few years, and I'm excited to have joined this group back in April, where we're using radial shockwave to treat inflammation and structural adhesions in the abdomen, and just having phenomenal results with decreased period intensity, improved fertility, reduced inflammation, really helping women with endometriosis, where oftentimes the only solution is surgery or hormonal medications that can provide significant risks or other side effects. And so to be able to offer something that there's no pain, there's no surgery, there's no needles or injections or medications or side effects, and it can dramatically reduce inflammation and provide better blood flow, and it helps to stimulate and restore improved collagenous health of those tissues. So the radial shockwave therapy is something we're now offering. Like I said, we're putting up a lot more content about this. Stay tuned for our stories. We're going to be showing you videos so you guys know what it looks like, sounds like, what to expect with all of that. But very excited about being able to offer something to a group of women that often have no hope. And especially when it's affecting our monthly cycle and especially fertility. We've walked with so many women through this infertility and miscarriage journey, and it can be so heartbreaking and so painful. And so we just are excited to be able to bring you this information, offer some additional solutions, and provide more hope.